Welcome back to me. A beautiful day in North Georgia. Okay, go ahead, BKP.
That's okay.
You don't know about the time?
No, yes. Hey, thank you for joining us. It's time for Ask the Doc with Dr. William Whaley and Dr. Raymond Tidman here. And again, thank you, North Georgia Cancer Research affiliated with Northside Hospital, for this segment. We appreciate it. We have a couple questions from you, the viewers. But first, so this is, now listen, I know this one.
You do. It's been worn before.
Preventative medicine tie.
That's right. Because we were talking off camera.
Right.
You were saying the Biden miracle. And I'm going to hold this to the end, but Ray knows I've got the top 20 news things in medical news each week here.
Dr. Whaley always goes and says, hey, I'm going to pull what are the most recent things going on in the news when it comes to medicine.
Yeah, usually,
so we're going to hold that.
Yeah, well, sort of. I'm going to introduce it. It's usually the previous 48 hours.
Right.
And I pointed out that this changed on the 21st of January. Every one of these, top 20 before, was COVID-related. Now, the only COVID-related one in the top 20 is that Dolly Parton said she wasn't going to get her COVID vaccine shot till everybody else had theirs.
Oh, okay.
Okay, and then I always focus on cancer, and we're going to focus on the cancer at the end here, but the facts have changed about the high cancer. So it's going to come at the end. All right, that's all that. So that's the tie. The rain's equal, and we don't need a truck today.
And how are you?
It's above freezing.
And how are you above freezing?
For the first day in 3 days. Okay. All right, you want to tell us what the questions are here? They got some big words here.
Well, we have to remember, like for our northeastern friends that are out there, they had 3 foot of snow. So and I tell you what, when you get the old snow shovel out, you have to be careful. Heart attacks. Yeah.
Yeah, and bad backs.
We still have heart attacks in this
country? Still have heart attacks, yes, in this country.
You mean everybody doesn't have a snowblower?
BK, I have family in Pennsylvania also, like you, and I sent them a picture of our blizzard last week.
Did you?
The 8th or maybe 16th of an inch. Yeah, it was on a glass table, so I could really measure.
Yeah, right. It was.
So I sent them a picture.
It was on the top of your car.
Well, the table was 30 inches off the ground, so I said we had 30.1 inches of snow.
There you go.
That's measuring
I think that's
accurate.
Well, I got a daughter and a grandson and 3 grandchildren in Manhattan, and you know how they're handling this winter, don't you? They went to Palm Springs the day after Christmas, and they're coming back March the 15th.
There you go.
Yeah, New York shut down, Palm Springs didn't, so they're having a big old time. All right, anyway.
All right, let's get to medical questions of the week.
Yeah, okay, I can tell you this very first one is absolutely a follow-up on something we did about 4 weeks ago because of the way it was written. My father just moved up to the mountains from South Florida, where he was treated for 10 years for polycythemia thick blood. First by him donating blood at the Red Cross. Then later by having blood drawn off at the doctor's office. Now that he is with me, he has symptoms, itching, and he can't eat due to getting full. And the hematologist wants to give him a Jak Pill. He is in good general health and 78 years old. What do you think, and what are his other options? Well, you know all about polycythemia because we've done it before. Emily, clap that first one up there, because we're going to get this out of the way in a pretty good hurry. But this man has been, not only has he been well treated, but he's lived over 10 years with a myeloproliferative disorder. So what you see up on the screen there's bone marrow there. That's too many red blood cells. Remember, we've gone through that before. I was telling Jeremy about the Pickwick papers and how all of these medical problems were described by authors long before doctors knew anything about sleep apnea. Mr. Pickwick had sleep apnea and gout. Well, anyhow, they used to talk about people with red face, red ears, thought they were all Scotsmen. They had too much red blood. Take that one down, Emily. So, by definition, upper limit of red count is something. This says 47%, 45%. Pull that back down, Emily. So when a patient goes in and gets a physical from Ray, and their face is red and their hands are red and their red blood count's pretty high, then that means there's too much red blood. So that's polycythemia. But there are lots of different causes of it. So he has real polycythemia. They diagnosed that in Florida. Show the next one. That picture there shows right in the middle the spleen.
Mm-hmm.
So when the spleen gets real big, that's right in the middle of your stomach, isn't it?
Yes.
So the reason he's not able to eat, I'm making the assumption is, when he eats, his spleen is pushing on his stomach. So his spleen has gotten big and he's itching. Show that next one. Now, I always like to show you one of these, but up here is the elevated red blood cell count. There's 50 other different reasons you can have it. Cigarette smoking, you're taking testosterone.
Sleep apnea.
You're on diuretics or whatever, or you live at the top of a mountain, or your kidneys are bad. So when you get all the way down here, pull that one down, Emily. When you pull all that down and you get to the subset of all the elevated red counts that are polycythemia rubra vera, and that's probably 1 out of 4, very first thing people generally note is the itch. And so he's itching. So there's this long list of stuff that they give kids who've got the scabies and stuff to stop itching, but that attacks the symptom and not the cause of the problem. Remember? I said, if you got a fever, I can give you Tylenol, but the intellectual thing is why you got the fever. Is it the flu, or you got a kidney infection, or what? So show that next one. Jak Pill. Here it is. There's the Jak Pill. You got that up there where folks could see it? All right, now pull it down, because here is what we went into before. And that is that
in this entire question, I have to tell you, I've been waiting for the Jak Pill.
Okay, remember now, there
It's a
is
southern
a
treatment.
genetic mutation that causes many of these diseases, from breast cancer, colon cancer, anything else, but red blood cell, polycythemia, chronic myelogenous leukemia, all of these have genetics, and the gene was called JAK2. So this new pill specifically blocks that gene, and it's expensive, this pill, but you don't have to draw blood off anymore. The spleen shrivels up. Pull it down, Emily. The spleen goes down. The man can eat. He doesn't have to have blood drawn off anymore, but the quickest relief of symptoms is itching. So a lot of people, when they got this too much blood, they say, well, when I get out of the shower, I just itch like I'm on fire. So this is the right treatment. It's down, Emily. This man was very well treated. He's had a 10-year survival. We know by the way the question's asked, he has the positive gene. And his proper thing to do is follow his doctor's advice, take the Jak Pill. He's not going to have to pay the $5,000 deductible every month. The company's going to make that pill available to him. Nobody, if you have no insurance at all, if you have bad insurance, whatever, if you need that pill, that drug company is going to make a way for us to get you that pill. So let Papa take the pill. There.
And we lost one of our beloved physicians in this county to polycythemia vera.
Really?
Dr. Jack Roof. So.
Yeah, and Dr. Whaley treated him.
Yeah.
And he had a bone marrow transplant. So this patient is not to that situation yet. Not to that situation yet. And that diagnosis is made 90% of the time by family physicians when they see patients doing a routine workup, physical, or the patient comes in and they got a complaint of, itching or something like that. We never see these patients until Ray or somebody likes them says, hey, wait a minute, your red count over the last 3 years has been going up every year, and you need to go see a hematologist. And this patient needs to end up in a hematologist's office, and he had one in Florida, he got one up here, he got the right treatment.
Let me say, that's a very good question for the viewer that sent that in. That's a very good question, and you can always send your questions to info@FetchYourNews.com, info@FetchYourNews.com, or find our social media pages and send us a question that way. Just put in the subject line, ask the doc. And so many things there also that we've always said. That question is very good because we have the health history the age, male, the details there to be able to answer the question are all there that you usually ask for in a question, Dr. Whaley.
Yeah. Might I throw in one other primary care aspect of this? The nomenclature, poly means many, cythemia is cells, so many cells, is still a fairly rare cause of an elevated hematocrit or hemoglobin. So people that come in with an elevated hematocrit will get a pretty thorough workup ruling out other more common things before they narrow it down to polycythemia. As we've thrown it out there, living at a high altitude, effectively living at a high altitude by being sleep apneic at night and being oxygen deprived, all these other causes that
we weren't going to say anything about sleep apnea and tobacco abuse since you don't smoke, but sleep apnea is a big one.
Big one.
And cigarette smoking.
And very silent and very insidious.
That's a Pickwick syndrome, Pickwick and that big old guy like that all the time.
Couldn't stay
That was
awake.
sleep apnea described 150 years before we knew anything about it by Charles Dickens.
I'm just so glad we have you to pick on every
How did
morning.
Charles-
One thing I'm thinking,
How did Charles Dickens get into
for some
this
reason,
program?
every Friday, I think there's a diagnosis going on here. And two, I want to tell you something.
Yeah.
Never again do your sleep apnea impression. Don't do that anymore.
All right. Well, Mr. Pickwick. That's anybody. I asked.
Don't do that.
I asked one of my nurses, who has a real Bachelor of Science from a big school. The other day, I said, "Well, you know about Pickwickian syndrome, Mr. Pickwick." You know something? People don't read that stuff anymore. This next question.
Moving right along, our second
all right.
question.
Well, this next question, I'm going to. It points to something that. Let me read the question first, and then I'll get into the thing that really bugs me. My mother has been treated for follicular lymphoma 7 years ago with chemotherapy and 2 years of an antibody infusion every 2 months. When she was followed up for a while, they did CAT scans often. But for the past 2 years, they said she doesn't need them. I pushed them and they said, Ray, listen to this one, she didn't meet the guidelines. I still want her to have one. What do you say? Well, first of all, I'll say you could always pay for it if you want it that bad. But I don't mean to be flip. I'm older than most of than y'all, and probably not older than most of your audience. But there used to be a time, and Ray remembers it, when we walked around with a prescription pad in our pocket, and if you came in and could write you a prescription for an antibiotic or something, and he could say, I want to send you over to the hospital for a barium enema, and then if you've got diverticulitis, I want to send you over here to Dr. Jones to get an operation. Well, we can't do that anymore because the drug might not be on your formulary, the hospital might not be in your network, and Dr. Jones might not be on your plan. Now, is that so? We feel like we're walking around with handcuffs on us. Now, this is not the same thing, but it's the same control, and this control, I think, is a little bit more reasonable. Now, Ray talks all the time about research and how things are done. There's different degrees of evidence. We are confident, this is called category 1 evidence, that after the nighttime follows the dawn, right? Now, it rains sometime when there's no clouds in the sky. So you're not sure when it's going to be raining. Well, put that thing up now. I'm going to show you this. This is one page out of thousands in what are called NCCN guidelines. NCCN guidelines version 1.2021 and talking about lymphoma. And it says, after you have completed your course of treatment, there should be a history and physical and labs every 3 to 6 months for 5 years. So that they were probably doing those scans for 5 years after diagnosis and 3 years after they finished the maintenance. That guy got perfect treatment. And repeat imaging only as clinically indicated, meaning that once you've gone through that immediate period where they were doing those scans,
Right.
quote, clinically indicated. So if you don't have something that you've got in a laboratory test, or you don't have a new lump or bump in your neck or a big spleen, and the doctor orders that test, and then the insurance company looks at the documentation, they're either not going to pay for it, and if you're going to get it done, the hospital won't schedule it unless you say, I'll write the check. So basically, I'd say that patient should continue the regular follow-up, get the blood test, get the hands-on exam, which it says do, and then if something shows up, dad starts losing weight, running fever, gets a lump in his neck, do another CAT scan. So I don't believe there's any choice you've got there other than to pay for it yourself or follow the rules.
Well, that's kind of following the rules.
Yeah.
I mean, the bottom line is where things have gone amiss is a third party has granted itself a medical license. And instead of that, the word guideline there is a misnomer. It's fine for it to be a guideline. It's fine for it to suggest to physicians, hey, have you done all these things?
Right. The insurance company takes that as the Bible right there.
They take that as a medical degree. But if Dr. Whaley said, okay, that's the guidelines, but I need this, this, and this, the insurance company should back off and say, you know what, I don't have a medical degree or licensing. I don't even have my hands on this patient. So I don't know what else is going on, and I need to do what the patient's doctor says I need to do, not what the guideline says I need to do, which saves me money. So that's where things are completely wrong with third-party payers.
Right. Not only that, but that makes Ray's nurse, and hopefully the nurse can do it. Otherwise, he's got to do it.
Hours.
Do what's called peer-to-peer. So now they say, well, if Dr. Whaley wants that bad enough, he's got to have a talk with Brian Pritchett and convince Brian Pritchett. And Brian Pritchett's going to have a screen in front of him, and he's going to talk to my nurse, and then my nurse practitioner. If he ever gets to me, he's going to wish he never talked to me because I always lose my temper. But you have to, I mean, seriously, you have to fight for that. We have 2 people in the office that are pre-certification experts. And they are on the phone hours and hours a day. That's 2 salaries that are...
2 salaries that are not doing health care.
They're not doing health care.
All they're doing is fighting insurance companies who the bottom line is their money, and they've stuck that overhead down on you in your office.
That's correct.
And they try to make you so miserable that you just throw up your arms.
Anyway, so we're not here to talk about...
Well, no, I mean, you hit on some things. Americans out there... you went right in, and I'll just say it like this, you went right into their living room this morning and you talked directly to them, and they're understanding what you're saying, because I'm sitting here on the couch with you, and the last time I went to the doctor, I was there more time for them to see what medications. I was in the office more time not seeing the doctor.
Yeah, filling out papers.
For them to go back and see what medications were approved that they would like for me to be on in my plan, or then I've heard this myself, that someone's not in my network.
But
I mean, this is something that everybody out there deals with. So if your doctor says, oh, I want you to go have this test, now you got to figure out what hospital they're going to send you to, because is it in your network? And then you got to go look at the list of doctors and say, or you know what I'm saying? They know what I'm saying.
I'm going to give you one more. This is January, okay?
Right.
So Medicare, when you come in, is going to pop up a bunch of questions. Do you feel safe in your home? What's your alcohol intake like? And blah, 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 like that. But your drug plan, I'm going to use a drug name. You may have been on a generic Benicar for your blood pressure, and you refilled the prescription on December the 1st. December the 5th. And so January the 5th, you go over here across the street and say, I want to refill my Benicar, and they say, oh, it's not on your plan. Well, wait a minute, I just filled it last month, because the formulary changes for your insurance carrier on January 1.
Right.
Now, this goes back to uncompensated care. So then the insurance company tells Dr. Tidman, you got to come up with a substitute for Benicar, otherwise he's got to pay $300 a month for it. Pick something else off our list that will work for him. Now, it was on their list last year.
Oh, by the way, they sold it to him because he had to pick the list in the beginning of December, and then at the end of December, it's not on the plan anymore.
Yeah, anyway.
So it's a little slip.
Anyway, so
guys, I just did that in January. I just went through that.
All right, let me just give you the rule
I had to change some medications in January. Go ahead. Yeah, they know out there.
This human psychology, okay? And it's one of the places our country's going wrong. We are autonomous individuals that have our own agency. We steer ourselves through life. We make our mistakes. We learn from them. We go on. In life, when you find there is a third party that's constantly interjecting themselves between you and the other person, it's unhealthy. I think it's essentially wrong. And so it's not just these insurance companies that are third parties that are sticking themselves between the patient and the doctor. It's all through life.
All right, wait a minute. I'm going to give you one now. This week, I warned you about this one. This week, on the same day, the little man who's the most highly compensated federal employee in the United States stood up and said, who is calling me? I don't know, good. Spam or stood up and said, we need to immunize school children to get to herd immunity. Later in the day, the CDC said we should open up the schools and the kids and the school teachers don't need to be immunized to get back in school. Now, you said all the government's all working together. Well, this is the same department here, coming out with 180-degree different type of advice. No wonder people out there are confused.
Well, they're not only confused, but they're upset. Can I go off on my rant now?
Yeah, go ahead. I mean,
when you and I
keep your rant down. Right.
Okay, I mean, I won't use any swear words, but back in my previous life as an engineer, we had this saying that if the only tool in your toolbox is a hammer, everything looks like a nail. In our lives, in our professional life, a physician is responsible for looking at any treatment that they offer, the benefits, the cost, and the risk. Okay, we look at it all. We don't just get to look at the benefits. Well, it would be inappropriate to just look at the benefits.
You got
and not
the hazard
consider
and the benefit over here. Now they're making you look at the cost. Go ahead.
Well, okay, but the hazards are the risk of the treatment. It's part of what we do. We have peers sitting at the top of the agency that I shall not mention, who came out with a treatment that didn't look at the cost and the risk and the down effect. Didn't even consider it. They're looking back 100 years with their hair on fire saying 1918 there was this terrible pandemic right at the end of a war when everybody's all disarrayed and being put on troop ships and everything's in chaos that was beyond hell. And that's the only thing they can see. And so, okay, well, let me get my hammer out and let me tell everybody in the world to go hide and let's shut down economies. And I don't care what's going to happen to all those people. That's malpractice in our world. Malpractice. Okay? And what's worse is that when they got new information that said, you know what? It's 1/10 as bad as we thought it was. At best, 1/10. So they got new information. So you can say, okay, well, they think Godzilla-bacter's here, and we got to deal with Godzilla-bacter. But a month later, when they started finding out, you know what? It's 1/10 as bad. They didn't adjust their treatment. Not only did they not adjust their treatment and have not adjusted it for a year now, they didn't come back and say, what is the cost of our treatment? Now, they had a few physicians like Dr. Atlas come out very clearly and say, you know what, it's not that hard to look at the cost of this. It's not that hard to go out into the economic world and look at when you inflict poverty on the world and on societies, what that does to them. We can do that. A lot of them said, no, we got this hammer and we're going to use this hammer until we've killed this Godzilla-bacter.
Well, I think that the kids in the schools that aren't getting to go to schools are the ones that are getting hammered the worst.
The worst.
I feel bad about small businessmen, and I feel bad about the airlines, but I got 2 grandkids in Atlanta, DeKalb County schools, and not been to school since last March.
Atlanta's discussing summer school. They're talking about having to hold kids back a year.
They've lost a year of education.
Right.
Not only that, they've lost a year of football, wrestling, socialization, dating, making mistakes.
And if they were seniors, opportunities to get into grander sports. Myself and the mayor of Chicago probably disagree on everything. But bless her heart, she came out yesterday almost in tears, screaming at the Chicago Teachers Union saying, "You are hurting children. Stop it. Get over yourself. These children need to be back in school. They need to be educated. Their parents need them in school. They need to move on." And when somebody that extreme from me is coming out in tears and saying, "This is abusive," and we have this abuse. I mean, Quebec, Canada, they still are locking people in their houses after 8 o'clock at night till 5 o'clock in the morning. What, does the virus come out at night? What kind of science is that? I mean, there are people doing things in this world that our future generations will look back and they will think that is as stupid as in the Middle Ages when people flogged themselves so that the plague wouldn't kill them.
Well, I won't say, if you would say, you may ask, okay, well, what's this got to do with medical, and ask the doc and whatever? It does, because what this has done, the seriousness of COVID is real.
Well,
it's real. It's real. But
what
we have done is, it's not just COVID. It's psychological abuse to our children, physical things that they're not getting out and getting their exercise.
Child abuse is getting worse than everything else.
One thing after another. Domestic violence.
And it's back to what I said earlier. It is a third party.
Right.
That's decided that they can interject themselves into your life and control you. And they need to get the hell out.
Let me ask you this now.
Okay.
Wait a minute. Now, as I said, I got 2 grandkids that aren't in school. They got a third brother who is. He's going to a Catholic school. He wrestles, he does rugby, and he plays football, and he goes to school every day. And it's in the same household. Now, explain to me why the private schools are open and they're doing just fine, and the public schools with a union aren't. That's right. Okay, now we're going into here. All right, we're getting out of that. I got to stop.
Yes,
we got to get back to work here.
Moving right along.
Moving right along. Okay. In terms of what we
relax.
In terms of what I want to say about the new, because we're coming up here on the expert panel in a minute. This COVID thing is serious as a train wreck. All right?
It is.
It's serious as a train wreck. All right, now, Georgia has had 13,000 deaths. 763,000 cases. Fannon's had 55 deaths. That's a lot of deaths in a little county like this. We had a couple car wrecks in the last few months. 1 or 2 people died. It was a huge thing. So Fannin County's had almost 2,000 cases.
Okay, I agree.
55 deaths, okay? It's serious as a train wreck. So we need to do, our fine china needs to get immunized. Our people over age 65 need to get immunized. There's a website you can go to today very quickly under Georgia Department of Public Health. Hit COVID vaccine locator and then put it in your county, and it'll tell you everybody in the county that's got the vaccine today. Go on the vaccine thing every day, because some small pharmacies that never even ordered it are going to get 20 doses, and then this morning they'll be on there, and you may go to a family drugstore. So keep on, get on your virus, get it
every day.
You're over age 65,
exactly
every
right.
day. Go on there every day. But here's the thing that's impressive, and that is that the death rates they've fallen 23% in the last couple of weeks, and the total number of positive cases. Remember, we were at 18% 2 weeks ago. We're back down to 11. When we get down below 10, and that ain't much farther, we're open here. But when we get down below 10, there ain't any reason in the world why Atlanta schools and stuff shouldn't be wide open and playing football and everything else. All right. So lastly, I want to get to the biggest thing I think in the news, and it was just last week or week before last. We said lung cancer is the number one diagnosis in women. prostate cancer is the number one diagnosis in men, and the number one cancer diagnosis in the country is colon, because it's number 2 in each. Love Georgia Tech, love the Pete Petit School of Bioengineering, and here's the numbers. Breast cancer is now the leading cancer diagnosis. 1 out of 5, and there's 5 of us right here, will get cancer. 1 out of 8 males and 1 out of 11 females will die of cancer. But breast cancer is now the number one cancer in the country, both sexes put together, 11.7%, and then lung is 11 and colon is 10.9. So there are still the big 3. But the one thing about it is, you make that diagnosis of breast cancer by going to your doctor and getting your blinking mammogram, for crying in the night. And you get that colon cancer diagnosis. You don't wait until you bleed, you got abdominal pain, you go in there and you get your colonoscopy at 45 or 50, depending on your history, and the appropriate interval thereafter. And you get that lung cancer out of here by getting the rest of the tobacco out of the daggone world, which they're doing a pretty good job of. And that's why lung cancer diagnosis has fallen like a rocket. That's why breast cancer diagnosis is going up, because people are getting mammography. And as we said a couple of weeks ago, mammograms were down 12, 14% or something like that all through the last half of last year. But we have been on this program and other people on other programs pounding at it. Get out of your house, get off to your doctor, and get your exam. Now, I live in a home with a friend of yours, and she went to an eye doctor yesterday for the first time in a long time. An eye doctor up here in the mountains, went to Yale and everything, and he noticed that she may have a pressure issue with her eye. Well, if you're seeing good and watching the TV and you don't have any trouble driving and you don't go to your eye doctor every year or two, glaucoma and retinal diseases don't give you any warning. You gotta get to the doctor's office. His, not mine. You only get to my office when you go to his and something turned up wrong.
Final thought of the day?
No, it's your turn, Ray.
It's your turn.
Okay, well, let me tie everything I said together. So, as individuals, if to the degree you find some third party poking their nose in your business, you need to push them back. We need to get back to being Americans, no matter what field it is. And to those school folks in our county or in our region who can hear my voice, if you are treating children any differently than the flu, then you're mistreating them. Okay? So all this COVID rules and COVID nonsense and, somebody had a contact, we got to shut this down, got to run hide in children needs to end. COVID is better. COVID's not good for anybody, but the flu is harder on children than COVID. So if you're treating them different than the flu, you're mistreating them.
Got it. And you? You out?
No, I've already said go to your doctor and get your daggone preventive medicine thing and then donate blood and take the vaccine. I'm not getting off the donate blood. We got to have blood. I'm not going to get off take the vaccine. And I'm not going to fight with anybody about the vaccine until everybody over age 65 and every nursing home. Here's the thing that bothers me: that only 25% of nursing home workers voluntarily took the vaccine in phase 1.
In the country or in?
In the country.
Because locally, RALF, almost everybody.
Yeah, well, and
that's because you have good coaching and a lot of.
That's right, and I got on, and even in physicians' offices, the numbers were like 60%. So I got on my bandwagon to all of our people, and I even gave them a link to watch our program of 3 weeks ago. Said, look, click on FYNTV.com, go to the Ask the Doctor playlist and get the one that was 3 weeks ago, and we talk in great detail about the fact that there aren't any significant there's no contraindication to giving the vaccine unless you're allergic to the vaccine. So there's nobody that shouldn't get it.
And we're now millions of doses, many millions, tens of millions of doses into this. And there's no pattern showing up that's catastrophic.
Yeah, so you get a sore arm 1% of the time, and a few people are going to have chills the next day, and that's just the same as you'd get with a flu shot or a tetanus shot, for crying in the night.
There you have it, folks. Dr. Raymond Tidman and Dr. William Whaley. Dr. Whaley, I appreciate you very much, both of you, for coming out and answering these questions. If you have a question for the doctors, send it to Ask the Doc. Dr. William Whaley, we send them to him in advance. Ask the Doc. Send them to info, I-N-F-O, at FetchYourNews.com. Find FetchYourNews, FYNTV.com on social media. Just like Dr. Whaley said, if you'd like to share these segments with family and friends, go to FYNTV.com. Ask the Doc. Share all of the segments are there. Also on our YouTube channel, FYNTV, Fetch Your News playlist. Ask the Doc.
And you'll see during the whole thing a Northside Hospital little logo
Absolutely.
up there, right, Emily? All right.
Now, thank you, North Georgia Cancer Research. We thank each and every one of you over there. I know a lot of your staff over there, great people. Thank you, Northside Hospital, affiliated with Northside Hospital, for the segment. We're going to take a break. We're going to come back. It's time for our all-star political panel.